All right, let me bring you this now. The country's COVID-19 infection remained top of mind this morning with the news that infections have doubled in the last 24 hours. So the Health Department has briefed Parliament on the Omicron variant and its readiness for the fourth wave. And for more on this, we're now joined by Health Portfolio Committee Chairperson, Mr. Kenneth Jacobs. Mr. Jacobs, thank you for your time this morning and good morning to you. It seems that there have been a lot of assumptions around the Omicron variant. However, I understand that you were briefed as the Health Portfolio Committee that not much is known about the variant just as yet. More investigations are still being conducted.
Good morning and good morning to all of the viewers. Yes, we were briefed last night. It was a very long briefing, about 2.5 hours. Very insightful, very informative, and the committee members were very excited to get this briefing. And yes, as it is with any new virus, or in this case a variant, there is little that is known in terms of its effects. In other words, what exactly is different about it and what would be the clinical picture? Would it be different from what we had seen before? We do not think that, or the scientists do not think that it would be much different, because this is a respiratory virus. And I think that it would not be as bad as we had with the first and second waves and even the third wave, and that we'd be able to manage this well, even as a department.
Right. Mr. Jacobs, just in terms of the population getting immunity from the virus, what was the briefing on that, especially because we know that these variants continue to change, the mutations as well continue to be different as we detect these different, variants of COVID-19. But from the population perspective and immunity, what do we know so far?
Well, so far we've been able to give individual doses of vaccines to the tune of 26 million, and individual doses of about, well, those are individual doses, but fully vaccinated about 16 million people. Now, we do know that there are two effects at a biochemical level which must happen. That when one is either infected or exposed to a vaccine like this, there are two things which happen. One is that one develops antibodies, and the second one is that one develops helper cells. So in terms of the antibodies, there is a thought that the virus is able to circumvent the antibodies, but in terms of the helper cells and the killer T cells, there is a thought that they would be able to protect people from severe disease and even moderate disease. Right. So actually, on the one hand, yes, the people can get reinfected. On the other hand, they do have protection once they are vaccinated.
So with that being said then, are we saying there's a likelihood that the Omicron variant might be present in all provinces at this stage, even though little is still known about it?
Yes, it is actually. There's only one province that it is not present at the moment. So it's been detected in 8 out of the 9 provinces, and it is increasing quite rapidly. And people really have to be careful about and take this very seriously at this moment.
Yeah, I spoke to Dr. Mzuko just earlier on, Mr. Jacobs, about the state of preparedness, especially from a health perspective, for this looming fourth wave. What's your perspective, just in terms of how prepared government is, how prepared the country is? Because, of course, Dr. Joe Patla did say we shouldn't be scared, we should stay calm. It's no new territory for the department, but are they prepared, for this fourth wave?
According to the presentation, yes, it was put very clearly that there were lessons learned from the other waves, and it does make quite a lot of sense that when one has had exposure to something that you'll be able to be better prepared. So in terms of hospitals, infrastructure, in terms of health systems, in terms of beds, being able to cater for the patients, in terms of vaccine, oxygen, and also in terms of the necessary therapeutics, the hospital system seem to be geared up for this.
All right, we'll leave it then. I appreciate your time this morning, Mr. Kenneth Jacobs. Thank you so much for speaking to us, chairperson of the Health Committee. Thank you for your time this morning.